Namaste. A warm welcome to everyone. Good evening, respected dignitaries, guests, and all attentive delegates to the National Web Conference on SAMSIDDHI 2020, 10th day on this marvelous Monday. There is no deity superior to the Guru, no gain better than the Guru's grace, no state higher than the meditation on the Guru said by Muktananda. With this, I salute all the Gurus and enter into today's session. I request Dr. Sudhir Raj N, Principal of Ayurveda College, Coimbatore, to convene the gathering. Sir,
Namaste. A very good evening to all. Welcome to our national webinar series SAMSIDDHI 2020 conducted by Ayurveda College, Coimbatore and powered by DIKSHA e-learning. Thank you all for finding time and joining with us today. Actually, SAMSIDDHI today is the 10th day. I am very much delighted to invite Dr. Narayan Bavalati, Associate Professor, Department of Shalakitandra, All India Institute of Ayurveda, New Delhi. He will be talking on the topic Management of Common Ocular Disorders in General Practice and Ayurvedic Perspective. From his busy schedule, he took time and had agreed to spend time with us for the session. On behalf of all the SAMSIDDHI team, I welcome you, sir.
Thank you, sir.
In the second session, we are graced with the presence of great teacher Dr. Bharati Kumaramangalam, Professor and HOD, Department of Prasudi and Sriroga, National Institute of Ayurveda, Jaipur. She will be talking on the topic Practical Aspect of Uttarabasti in Gynecological Disorders. So she is having 22 years of clinical experience and 17 years of research experience in CCRAS. With so much of gratitude, I welcome Dr. Bharati Madam also for this session. I welcome all the participants from all over India and abroad who join with us. Thank you very much. My special thanks to all the faculties and students who had worked hard as a team for making this event a grand success. Thank you very much.
Thank you, sir.
Samyak Prayogam Sarvesham Siddhirakyadi Karmanam, which says, in all activities, proper application yields success. Thereby, we have two experts to enlighten us in the clinical aspects of Shalakya and Striroga. Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. Filling your full name to be displayed is appreciated. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly. And if the problem is within our network connection, kindly raise the issue in the chat box. Any question regarding the session can be raised in the link provided in the chat box, which will be addressed at the end of the session.
Now, I invite Dr. Puntrikakshara, Associate Professor and HOD of Shalakitandra, Ayurveda College, Coimbatore, to welcome Dr. Narayan Bavalati. Sir.
Good evening, Dr. Narayan sir and Principal sir and all the other delegates. And I think so many known persons are there in the webinar. Welcome one and all. On behalf of Ayurveda College, Coimbatore. You have come here, and one point I want to tell before joining itself, before starting the session, without opening the bottle, we are unable to put anything inside the bottle. So, if you want to put, we want to open. So, you open your mind, be calm, concentrate on the slides and what sir is telling, so you can get the knowledge. So, this is the one basic instruction I am telling to the delegates. And I welcome to Narayan sir in his busy schedule. Now, before starting the session, we discuss about this. Sir Sudhir sir and Narayan sir talking about this regarding the COVID. So, sir having the COVID duty, and after that he came, and so I was so happy after seeing the Narayan sir with the slides, because yesterday we were a little bit difficult to face the difficult to see the slides. Okay, after that finally it's solved. Now also it's very good.
Sir, yesterday I am there in hotel yesterday in quarantine. Today I am at home.
Yeah, thank you, sir. Thank you so much for your very happy face
Yes.
after doing all the duties also. Thank you, sir. And it is by the end of the session, you will feel happy. I think so, because without having the knowledge of the ophthalmology, it is very difficult to treat the patient in the general practice. So all of you get the knowledge with this. I welcome Dr. Narayan sir. Sir having the 13 years of experience in the ophthalmology. Sir completed MD and PhD also. So sir will give nice feast to you. Thank you one and all. And it will be, I will congratulate once again Dr. Sudhir sir for this platform, and Narayan sir also, we came here for the presentation. Thank you.
Thank you, sir. It's a great pleasure for me to introduce Dr. Narayan Bhavlati, who is presently working as Associate Professor, Department of Shalakya, All India Institute of Ayurveda, New Delhi. He graduated from Rajiv Gandhi University of Health Science, Bangalore, Karnataka, and post-graduated from the prestigious Gujarat Ayurveda University, Jamnagar, and completed his PhD in the same institute. He has started his career at 2007. During his 13 years of career at different institutes, his contributions in the infrastructure and clinical facility development in the Department of Shalakya Tantra at SDM College of Ayurveda, Udupi is worth quoting. He has numerous publications and has contributed one chapter in the book entitled Samsiddhi, Foundation of Complementary Surgical Structure. He is an active member in many committees at AAIA and working efficiently for the development of institute and organization. I am very happy to invite Dr. Narayan Bhavlati to start his session. Sir?
Thank you, madam.
Thank you, sir.
First of all, I convey my sincere regards to the team Samsiddhi, that is the from Coimbatore College of Ayurveda, and this is a great opportunity given for me to share the few things in front of you. Anyhow, the presentation, as I am earlierly communicated with the team, that the presentation is basically planned for the general practitioners and for the students. So the presentation for the specialty oriented team will be the different. The presentation for the PG scholars, presentation for the undergraduate, and presentation for the general practitioners differ according to their practice in general practice. So as we start with this presentation, one of the basic human right is sight to see. One of the basic human right is sight to see. We have to ensure that no citizen goes blind or does not remain so. With available skill and knowledge, it is need to restore the vision if it is lost, or if it is deoriented or deteriorated, it is need to correct it at a particular time so that the person can get the better vision for a longer duration. So it is, as we all know, that Sarvendriyanam Nayanam Pradhanam. Even though the Panchendriyas are there, but the Nayana is considered the predominant one. It is in the body, because whatever we are seeing or the visual sense is gained learning by 90%. When we see the object, we can remember. Just I see once the Coimbatore College of Ayurveda, I can remember forever my throughout the life. Means that it is a strongest structure in the body, the strongest sense organs in the body can be recur the knowledge or can remember the things or to be the knowledge. So nowadays what we see that the many of the unhealthy lifestyle may leading to the disorders. So lifestyle that is all becomes the mechanical today nowadays, because we don't have a time. We don't have a time to stay. We don't have a time to follow the certain rules or regimens which are to be useful for our lifestyle. So among us that we can consider aharaja and viharaja. So fast food, no doubt that everyone is taking the fast food, or the cold drinks, cold items, everyone used to take this one. So these aharaja nidanas may leading to the ocular disorders independently, or these aharaja nidana may leading to the systemic disorders. So when is aharaja nidana and viharaja nidana, for example, using computer for a longer duration, it is one of the viharaja nidana, or thinking for a longer duration, or Shoka, Baya, Krodha, we can consider these as a Viharaja Nidana. When these Viharaja are the etiological factors may leading to the systemic diseases, or independently they may lead to the ocular diseases. When systemic diseases are there, if you are not taken the precautions at that time, it may further leading to the complications, or it may further leading to the manifestations of the ocular disorders. For example, in the Mithya Ahara and Mithya Vihara, there may be the manifestation of the diabetes. If diabetes is not treated in the early stage, it may leading to the complications, that is the diabetic retinopathy we can see. Or Mithya Ahara Vihara may certain extent leading to the hypertension, in turn may be leading to the hypertensive retinopathy, or all etc. like this. These conditions, if ignored in the early stage, may leading to the many of the ocular disorders in the later stage. So when we are talking today's era, that super specialization is there. For example, when we are considering the ophthalmology, in ophthalmology, many super specialization is there. Is there need to practice or need to discuss here about the ophthalmology in the general practice? Yes, if it is asked the question for me, it is very essential. Super specialization in the form of glaucoma clinic, retina clinic, vitreoretinal clinic, corneal clinic, like that many super specializations are there. Though the many super specializations are there, we are the general practitioners, we are the practitioners, we are the family physicians which are referring the patients to the super specialized doctor. Means that when we are referring the super specialized doctor, then we should know about the general things or the common factors which are responsible for manifestation of the eye diseases. If the manifestation of the eye disease is there, what we can do, what we can see, what our mind know, that can be observed from our eyes. So that is why all the general practitioners are the students, undergraduate students should know about the manifestations of the eye diseases in relation with the set of systemic diseases, because general practitioners come across the general diseases only, the systemic diseases only. For example, the systemic disease, you can take the diseases of the liver. When we can see the icterus is an early stage can be detected. By seeing the eye, we can assess or we can guess about the systemic diseases also. When we can see about the bleeding disorders, about the systemic diseases, for example, you can take the leukemia or some other bleeding disorders. Early sign of manifestation is can be found in the, that is the hemorrhages in the eye, that is a bleeding or the subconjunctival bleeding can be seen. Like that, diabetes, hypertension, leprosy, gout, rheumatoid, many more of the diseases can be diagnosed just by seeing the eye only. Means that if the general practitioners or if the undergraduate scholars, when patients came to the OPD, because as we know, Chalakte, since from long duration, it is neglected. It is a neglected because no one is, we don't have any referral system of patients. So when patients comes, all patients comes to a particular clinic, in particular clinic, then they are doing everything is they are practicing, including the specialty oriented practice also in certain conditions or in certain places. But if we know about all these factors about the systemic diseases in relation with the ophthalmic conditions, then we can easily refer the patient to the concerned specialist so that we can prevent the further manifestation of the diseases, or we can prevent the complications in the later stages. So hence, it is very essential to know about the some of the common ocular symptoms which can be faced in the general practice. So ocular disorders have the symptoms like the related with the eye. No doubt that the patient is suffering from the eye problem, but certain conditions the ocular problem may not be there. That is, the symptoms may not be related with the eye, or sometimes it may related with the eye. So then we can consider it is an ocular problem or non-ocular problem. When we are consider about the ocular symptoms, then the patients usually complains the impairment of the vision. So we can consider or we can classify the visual symptoms and the non-visual symptoms, or the symptoms may be mixed in oriented. Patients comes with the difficulty in the vision. It may usually the non-ocular, maybe the ocular, or it may be the mixed in origin. So when we are complaints about the distance vision, patients usually comes that the general practitioners that there is a difficulty in the vision, doctor, since from the 3 to 4 days. So when patients comes with the difficulty in the vision, so what we should know are how to ask. The metaocular history taking is very important in the ocular problem, not only in the ocular disorder, not only in the ophthalmology, but it is very essential in all of the specialties. So when patients complains about the difficulty in the vision, we have to inquire about the distance vision, near vision, or the night vision. So when patients comes, we should know about what are the common, we should think about the common factors and the common diseases. We should not move directly to the rare disease and the rare presentation. So usually when patients comes with the difficulty in the vision, it may be associated with the error of refraction, or maybe the amblyopia, or opacities in the ocular media, or amblyopia, or the neurological disorders. So when you come across the errors of the refraction, so in details we will discuss later. Or opacities in the ocular media, we should think opacities in the ocular media might be there in the cornea, or it might be there in the anterior chamber, or in maybe the lens, either in the vitreous. So at the different levels opacities are there. At that time also patients complains the difficulty in the vision. But if it is also oriented with the neurological conditions, then also the patients complains the difficulty in the vision. So these are the few points. Then we have to inquire about the when patients tells about the difficulty in the vision. So no doubt the patients complains the difficulty in the vision. Visual symptoms, when patients complains, that we have to ask gradual painless loss of distance vision is there, sudden painful loss of distance vision, or sudden painless loss of distance vision, or the diminished near vision. We have to inquire in about details in these conditions. By inquiring these things, we should know that the gradual painless loss of distant vision. So distance vision is losing gradually, but there is no pain at all. That indicates that there is a certain chronic diseases in which the patient is suffering, but it is gradual in nature. Means, for example, you can take the pteresium, you can take the senile cataract, or you can take the corneal dystrophies, corneal degenerations, like that. These are certain conditions in which the gradual painless loss of vision will be there. Sudden painful loss of vision, distance vision, sudden painful loss of distance, there are certain conditions. Patients comes with holding the eye, that I'm suffering severe pain in the eye. When patient is crying, at that conditions, we can assess certain conditions. For example, if the patient comes with the severe pain in the eye, with a painless loss of vision, that we can consider that the acute congestive glaucoma might be there. The glaucoma may be the different types of glaucoma. In that conditions, patients comes with the severe pain in the eye, we can say, or we can suspect that it may be the acute glaucomatous conditions. At that time, we have to take the detailed history, and then we can analyze accordingly. Sudden painless loss of vision, no doubt that the patient is quite normal. In the morning walk, patient has went, when back, came to the home, taken the bath, breakfast, everything is good. Then after around the 8 o'clock, 9 o'clock, or 10 o'clock around, patients has complained sudden loss of vision. Patients, when there is a sudden loss of vision is there, will not go specialized hospital immediately, because they have an available doctor, available family physician is there. They are going there, doctor, everything is fine with me. When I later on, suddenly in my one eye there is a लॉस ऑफ विजन, अब मुझे कुछ नहीं दिख रहा है, ऐसे पेशेंट आ जाएगा डॉक्टर के पास, हाँ ठीक है जनरल प्रैक्टिशनर्स है, बहुत सारा पेशेंट रहता है हमारा पास, तो हम ठीक है देख लो, ये हम दवा दे देंगे आपको, यू पुट इट फॉर 3 days, then come back for me, then I will evaluate. So we should know what are the red flags of the ophthalmic conditions. When patients comes with the painless sudden loss of vision, it might be associated with the detachment of the retina, detachment of the vitreous, or it may be vitreous band detachments, or like this. These are very critical conditions. We should know. If we should know these conditions, then we can refer the patients very easily. Hence, these conditions should be known for the every practitioners, or for the even graduates, undergraduate students also, so that if we know these conditions, then we can very easily refer to the patients to the super specialization or the concerned specialized OPD, so that we can prevent the further loss of vision. So another commonest complaint faced by the patient when comes to the practitioners is the glare, that is discomfort to the bright light. Discomfort to the bright light can be seen if the patient is having the immature cataract, large pupil, myopia or cyclopes. So when patient is around 60 years of an age, complains that the discomfort to the bright light, we can think about the stage of cataract. Or patient is having the young adult patient, so his complaints about the glare in the one eye, I am not able to see properly. At that time, we can assess that, or we can suspect that patient may suffering with the refractive error. Like that, according to the age also we can suspect. We can suspect if we know the conditions, if we know the disease, then only we can suspect it. So these are the general things everyone or the undergraduate students or the practitioners should know. So the patient comes again with the clinic that photophobia. I am not able, doctor, I am not able to see the bright light. Even though I am driving, at that time I am not able to see the bright light because profuse watering is there from my eyes. So whenever the patient is not able to see the bright light, severe watering is there from the eye, then we should assess, we should suspect these conditions. Patients may have the trauma to the cornea, foreign bodies might be there in the cornea, maybe the keratoconjunctivitis, or suffering with the acute iridocyclitis or the chemical burns. So if we know these conditions where the photophobia will be happens, then we can suspect the disease. Trauma might be there, the mild to moderate, or foreign bodies might be there in the different parts of the conjunctiva, or might be the cornea, or in the tarsal plate. Whenever the eyelid is moving, there is a scratching on the cornea, then patient sees discomfort, may have get the pain in the eye and photophobia due to that of the formation of the ulcer in the eye. So these are the certain conditions in which the photophobia can be experienced by the patient. So these are all are the visual, they are related with the vision of the patient. There are certain conditions in which the vision is not at all affected, but patients comes with the complaint of redness in the eye, watering, pain around the eye, itching, dryness, discharge. So these are other conditions which are not related with the vision, though they are the manifested due to the diseases of the eye, but vision may not be affected in these conditions, or these are the symptoms in which the vision may not be affected. So that is why we should know these conditions in general. So whenever the ocular headache is there, headache is very big headache for the every physician, or big headache for the every practitioners. So headache related with the accommodative or convergent disparity, maybe the uncorrected refractive errors, or wearing the wrong glasses, or the muscle imbalance. So these are the certain conditions in which the patient may comes with the headache. So there are certain things that are required or that are essential for the practitioners or for the general practitioners. See, there are simple equipments. By these equipments, we can assess the patient, we can suspect the disease, we can refer the patient, we can restore the vision, we can prevent the further complications by seeing the patient's eye by certain of these common equipments are the common. For example, you can take the torchlight, Snellen's chart, ophthalmoscope, fluorescent strips, Shermer strips, magnifying lens, then topical anesthesia. They are very common. They are not costlier. They are not sophisticated instruments. They are simple instruments. By these simple instruments, we can diagnose, we can assess the lot of the vision related problems in the day-to-day practice. So common examinations, ocular examinations in general practice, just I had told that simple torchlight testing, we have to test the visual acuity, simple chart light, that is the Snellen chart for distance vision and the near vision. If distance patient is not able to read the distance vision or the near vision, then we have to check for the PLPR, then the hand movement. Though we can confirm, it is a later stage where we have to test for the PLPR and the hand movement. Then examinations in general practice again includes the position of the head. When patients comes to the clinic, just by seeing the position of the head, we can suspect certain conditions, or we can assess, or we can suspect the patient turning head to the one side. Doctor, I am not comfortable, my eyes are burning, and is turning head on one side. Then we can assess that patient may have suffering with the squint, because in order to avoid the diplopia, patient turns the head towards that particular side. Hence, just by seeing the position of the head, we can assess. Or seeing the position of the head, or when examining, then we have see about the forehead. Forehead Forehead we can see about the scar, we can see about any signs of the inflammations, we can see about the wrinkles on the forehead, that is excessive wrinkles are there on the forehead. If excessive wrinkles are there, which side of the forehead it is the wrinkles are there. If there is no wrinkles, then also there is abnormality. Excessive wrinkles are there, also the abnormality. Then all these abnormal conditions can be assessed just by seeing the forehead of the patient. Like that, we have to examine the eyebrows, eyelids, then the movement of the eyelids. So when all these details we have to examine, then after that, to some extent, we can guess or we can suspect the diseases. So when patients comes, then we have to examine about the conjunctiva. It's a quite natural conjunctival examination. We should know how to examine. It's a by one hand technique or by the two hand technique. So what are the things we have to see in the conjunctiva? Conjunctiva, see, elsewhere in the body the blood vessels are situated subcutaneous, but here submucous blood vessels are there. Very easily we can, minute changes in the conjunctival blood vessels can be observed by seeing the conjunctiva. So in the conjunctiva, we have see the discoloration of the conjunctiva, papilla, follicles, then scarring, then concretions. These are the points we have to see in the examination of the conjunctiva. These concretions, follicles, all these are the different types of the conjunctivitis. If it is patient is suffering, at that time, these findings will be there. What are the follicle? Follicles are nothing but they are the boiled sago grain like a structure. When we are over the conjunctiva, you can see the follicles, which are whitish in nature. They looks like a boiled sago grain like structures. That indicates that that patient may suffering with the allergic conjunctivitis, because in certain allergic conditions of the conjunctivitis, our patients may have suffering with the keratoconjunctivitis, where we can see the follicles, boiled sago grain like things, or maybe the associated with the papillae like that. These are certain degenerative conditions, cyst in the conjunctiva, or any growth in the conjunctiva. We should analyze the conjunctiva or examine the conjunctiva in detail. After examining the conjunctiva, just we have to go for the sclera. What are the points or what are the things we have to see in the sclera? Discoloration of the sclera, any congestion is there in the sclera, any growths are there in the sclera, or any that is the changes in the growth that is in the form of the any swellings are there in the sclera. Like that we have to see in the examination of the sclera. Then comes to us the examination of the cornea, because systemically we have to examine the eye when the patient comes to us. When we are examining the cornea, we have to see that is the shape of the cornea, size of the cornea, sheen of the cornea, then sensation of the cornea. So there are certain conditions which the structural changes in the cornea can be seen. For example, if the patient suffering with the keratoconus, at that time comes with a difficulty in the vision, a distortion of the vision, मुझे एक दो objects दिखता है करके patients will usually comes. At that time, we have to see or we have to examine the cornea in detail, even though by the torchlight also. Though we are not having the slit lamp in general practice, it is very difficult to put the slit lamp, but by the torchlight also, to some extent, we can examine the cornea. Like that, the anterior chamber and the iris we have to examine in order to suspect the disease in particular. So the pupil we have to examine. So common examine torchlight only. It is sufficient to examine the pupil lens by the torchlight only. So when we are putting the torchlight on the patient's eye, usually in the general conditions, there is a brisk reactions of the pupil can be seen. When the patient is having not sluggish reaction is there, then it is abnormal condition, or the size of the pupil, color of the pupil, then that is the reaction of the pupil should be assessed by the examination of the pupil. Lens, the color of the lens can be examined just by the torchlight only, because as there is a changes in the lens, as there is a change in the cataractness, or maybe some other changes, the color is refracted to that of the pupillary area. Hence, the examination of the pupil may indirectly indicate the lens, nature of the lens. Is a cataractnous lens, it is a normal lens, or it is already operated lens for the cataract, or the eye is already operated for the cataract, their color of the pupil is changed. By this, we can suspect in the diseases. So after that, we can measure the intraocular pressure just by the tonometer. Tonometer is very not a costly one. It's very cheapest instrument we can keep. That is a indentation tonometer or Sears tonometer. we can use it and we can take the intraocular pressure very consciously. And after that, ophthalmoscopy is also very simple. It is more than that of the torch. So by fundus examination can be done even in the general practice. So by these things,